Hello everybody, I'm super excited to be here today to present TrackER. I'm an emergency healthcare physician by trade, and I've been at Wired Health a few times talking about Antarctica and working in extremely remote environments as a doctor. So today I'd like to present TrackER. And the idea of TrackER is essentially to connect patients with their emergency response. So the challenge currently is that as soon as you've taken the 999 call and an ambulance is sent to a patient, at that point the communication stops between the patient and the ambulance team or any emergency response team until they arrive on site. TrackER aims to bridge that gap by providing continuous communication during this period. There's real-world challenges for not having that communication. One famous case is Sarah Aviard, and I'm sure many of you are aware of this situation. And this came through a lack of identity. And so TrackER also aims to give the identity of their emergency response team so that the patient knows who they're expecting to arrive, a little bit like Uber with a photograph and a number plate as well. In my time working as part of pre-hospital emergency response teams, we're often able to get to the building really easily, but once we get there, there's often a sort of disparity with not knowing which door to go through, sometimes not having the correct codes, and also having to have often somebody flagging you down on the roadside, and that person could often be better used, particularly in sort of a cardiac arrest situation where CPR is required, and those extra resources are super valuable in those cases, and especially when there's only one person with the patient as well. It also aims, when the patient is picked up, to actually track the patient going to hospital, and therefore relatives are able to track where they go, in case sometimes helicopters and ambulances end up changing direction according to a clinical case, and certainly then onwards through their hospital experience as well. It's been shown by pizza delivery companies, and this was actually one of the reasons I thought of the app, is that there's a lot of improved patient satisfaction when you actually know how long it is going to be before you have your pizza delivered. And even in cases where it takes much longer for the pizza to arrive, customers are generally much more satisfied because they know where they are, because they have that autonomy. And I think that this is really important as well in patient care, especially in cases where it's a long time until the ambulance arrives. It gives the opportunity for relatives to prepare the patient, to know how long they have to come to their house, and to help really sort of empower both the patient and the relatives during that period as well. So the way it works is you call 999 as per normal, and the normal triage decision is made, and TrackER isn't employed until the dispatch has already been made, so the ambulance is already on its way. And then it connects you a little bit like Uber, so you send a hyperlink which connects the patient to the TrackER platform, and then from there you're able to see who's coming, as I said, the photograph and the number plate, and how long their sort of estimated time of arrival is likely to be. And from that, also, you're able to see how far they are away. So if you do feel that you need to put somebody out on the street, you can wait until they're sort of just around the corner before you decide to do that, and keep you as a team providing the optimum patient care before that time. You can also send photographs on the platform as well to help identify where you are. And this is particularly important in sort of more developing healthcare systems where the map systems aren't as well integrated. So we've got the ID verification, we've got the real-time tracking, the direct communication, and then also tracking your relative once they've gone in an ambulance. And this is also for fire crews and police teams as well. So I hope that TrackER provides a much more safer, faster response time. It also can improve efficiency, because currently, if there are any questions, the patient has to ring back up to 999, and so by having this improved communication, it should also help to reduce stress on the 999 teams as well, and overall improve patient experience and sort of a very patient-centered care product, improving care through communication. And it's also a good example of how Space for Earth technology using satellite connectivity, and it's also upscalable around the world, especially in developing healthcare systems where the communication is less good, and you've also got protracted evacuation times as well. Thank you.
Thank you so much for that. Really interesting, really enjoyed the pitch. Question for me to begin with is around, I guess, user experience. So could you just tell us about, have you tried this? Where does it work? How is it for the user? Just bring it to life a bit more, please.
So it's for after the emergency response, and so it's really to help reduce anxiety. And so the user can often be a relative or the patient, but this is often more useful as well for the relatives, because I think the key thing as well is sort of really empowering both the patient and the relatives to be able to make decisions autonomously, because I think a lot of the anxiety while people are waiting for you to arrive is because you're not really sure how much time you have or how to use that time. And so I think this really allows you to optimize that time that you have available to make sure that the patient's as ready as possible. And also in some cases when it's a minor injury, which doesn't necessarily need an ambulance, can also be taken to the local healthcare facility, bypassing the requirement for an ambulance, because often in the NHS we have long wait times, and if it's something that could be dealt with without that, then that gives them that patient choice as well.
Thank you so much. Great pitch. Curious just about your commercial model and go-to-market. How do you think about that?
So it's mainly, so I actually work in Geneva in the 144, which is the equivalent of the 999 centre in the UK. I'm a UK trained doctor, so I'm familiar with the NHS as well. But the idea is that the TrackER app is, the customer is, for, in our case, Geneva Canton, and then sort of working with those individual dispatch centres, and that's where the commercial model lies, but upscalable as well.
Thank you for the pitch. And is it currently testing only in Geneva, or are you active in any other markets at the moment?
So currently we're just developing it in Geneva, so that's where we are at the moment. We already have everything in place because so ambulances are already tracked and have been for a long period of time. So in the control centre, we've always been able to see where the ambulances are, and we've just traditionally been able to communicate that with patients when they've called back to us. But now this sort of bypasses that requirement, and it freeing up our dispatch centre staff to take more dispatch calls rather than updating patients on where those resources are. Thank you. Thanks very much. Thank you.